నమస్తే జీవనరేఖ కార్యక్రమానికి స్వాగతం. దీర్ఘకాలిక మూత్రపిండ వ్యాధి అంటే ఏంటి, దాని లక్షణాలు ఎలా ఉంటాయి, కిడ్నీ సమస్యలు రావడానికి గల కారణాలు ఏంటి, అసలు కిడ్నీ సమస్యలను ఎలా గుర్తించాలి, అలాగే తీసుకోవాల్సిన జాగ్రత్తలు ఏంటి, దీర్ఘకాలిక మూత్రపిండ వ్యాధిని ఎలా నివారించాలి అనే విషయాలు తెలియజేయడానికి ఈ రోజు మనతో పాటు ఉన్నారు అమోర్ హాస్పిటల్ నుంచి కన్సల్టెంట్ నెఫ్రాలజిస్ట్ అండ్ రెనల్ ట్రాన్స్ప్లాంట్ ఫిజిషియన్ డాక్టర్ కజోరీ గిరి గారు మనతో పాటు మన స్టూడియోలో ఉన్నారు. వారిని అడిగి మరిన్ని విషయాలు కూడా మనం తెలుసుకుందాం. అలాగే మీకు కిడ్నీకి సంబంధించి ఎటువంటి ప్రాబ్లమ్స్ ఉన్నా కింద స్క్రోల్ మీద కనిపిస్తున్న నెంబర్స్కి కాల్ చేసి మీరు డాక్టర్ గారితో మాట్లాడొచ్చు. Hello doctor, how are you?
Hello, fine.
Welcome to our studio.
Thank you.
So today we will discuss about what is chronic kidney. So
Yes.
tell me this.
Namaskaram, and I am happy to be here. Thank you. Chronic kidney disease is the gradual decline in the kidney functions. So first we have to know what are kidneys.
Yeah.
Kidneys are two bean-shaped organs in our body, and the main function of kidneys are to filter the waste products of our body and excrete it via the urine. So any injury of the kidneys will cause gradual decline or damage in the kidneys, causing chronic kidney disease. Initially the patients may not have any symptoms, and the signs or symptoms may be very faint, so they may miss the diagnosis of chronic kidney disease. But in advanced stage sometimes there will be increased symptoms, so we should always diagnose it early.
So mainly what are the common causes of kidney
Yes, ma'am.
diseases?
In India mostly we know that 1 in 10 patients are affected with chronic kidney disease. In India the most common cause is diabetes mellitus, that is type 1 diabetes or type 2 diabetes mellitus. Also the second most common cause is raised blood pressure, that is hypertension. Other causes may be glomerulonephritis, that is inflammation or injury in the filtering organ of the kidney, that is the glomeruli. Second, other causes may be interstitial nephritis, that is inflammation or injury in the tubules of the kidneys, that is the surrounding structures. And there will be other causes like cystic kidney disease or inherited kidney disease, polycystic kidney disease, chronic obstruction in the kidneys like stones, tumor, prostate gland can cause chronic kidney disease. And lastly, any family history of kidney disease can also result in this problem.
సో కిడ్నీ డిసీజెస్ యొక్క లక్షణాలు అంటే ఎలా ఉంటాయి, మెయిన్గా సిమ్టమ్స్?
Yeah. The symptoms of chronic kidney disease, as I told, initially they are very mild, so people often miss the symptoms till the kidney disease are advanced to a very advanced stage. Any symptoms in the body can occur due to chronic kidney disease. Starting, the patient will have decreased sleep, irritability, any behavior change, mood changes, personality changes can occur. The most common symptoms of this kidney problems are increased fluid accumulation in our body. So there will be swelling of hands and legs. Also there will be increased shortness of breath, chest pain can occur, nausea, vomiting, decreased appetite, not feeling to have food, plus other symptoms like dry skin, itchiness, itchy skin. All these symptoms can occur in chronic kidney disease.
మ్యామ్ కాలర్ ఇస్తే తుకారం నిర్మల్ జిల్లా నుంచి. తుకారం గారు నమస్తే అండి.
సార్ నమస్కారం మేడం.
సో డాక్టర్ గారు ఉన్నారు, మీ ప్రాబ్లం ఏంటో డాక్టర్ గారితో చెప్పండి. చెప్పండి తుకారం గారు. సో డాక్టర్ గారు
నాకు
యా చెప్పండి.
పాలిస్టిక్ కిడ్నీ డిసీజ్ ఉన్నది.
మీరు టీవీకి దూరంగా. ఓకే ఓకే.
2021 నుంచి ఉన్నది మేడం. అది
ఎప్పటి నుంచి అండి?
2021.
యా కిడ్నీ డిసీజా?
పాలిస్టిక్ కిడ్నీ డిసీజ్ మేడం.
ఓకే.
Question, what is ఏం ప్రాబ్లం
మేడం? అది ఇప్పుడు అప్పుడేమో ఓన్లీ లెఫ్ట్ కిడ్నీ ఉండే, ఇప్పుడేమో రైట్ కిడ్నీ టూ సైడ్ అయిపోయింది.
దిస్ పర్సన్ వాజ్ సఫరింగ్ రైట్ కిడ్నీ.
Only one kidney there?
Yeah.
Something? Okay.
In 2020 left kidney. Now
Operation done. Operation.
సో తుకారం గారు ఆపరేషన్ అయిందా?
కాదే మేడం, ఆపరేషన్ ఏం కాదు మేడం. అది జెనెటిక్ ప్రాబ్లం అన్నారు, అయితే బయట చూపించుకున్నాము. అయితే ఆపరేషన్ ఏమైనా సొల్యూషన్ ఏమైనా ఉన్నదంటే లేదన్నారు మేడం.
సొల్యూషన్ ఫర్ దిస్
Okay, I will discuss gradually that if any genetic problem or other problems may be there. So, firstly treatment will come later, we will start tell with that. First we have to take care of the diet is important, Babu. Tarvata medications will be there, nephrologist will tell some medications, and if we have to monitor the kidney function regularly by blood test and the urine test. If the creatinine is rising, then we have to take for dialysis, that is the last option. So, we will slowly go to the other treatment options.
ఎస్ తుకారం గారు, మీరు ఇది షో అయిపోయినాక డాక్టర్ గారిని కన్సల్ట్ అవ్వండి, ఫోన్ చేసి మీ ప్రాబ్లం కూడా మళ్ళీ చెప్పండి ఒకసారి. సో మెయిన్గా ఈ కిడ్నీ ప్రాబ్లమ్స్ వచ్చేటప్పుడు మనం ఎప్పుడు డాక్టర్ని కన్సల్ట్ అవ్వాలి?
సరే. So, mainly as I told, the symptoms are there. So, if any patient is having these symptoms, so they should immediately consult any doctor or a nephrologist. And there are other risk factors also. We have to know which patients are at more risk of kidney disease. Patients like diabetes, hypertension, obesity, increased body weight, and patients taking regular over the counter pills of painkiller medications, those patients they are more at risk of kidney disease. So, they should monitor their kidney health frequently, every 3 months or 6 months. And if any symptoms appear, or if in blood test or urine test there are problem, you should consult a doctor immediately, because in kidney disease, if early detection is very important, once the kidney problem advances, the treatment options are very few.
సో అమర్ హాస్పిటల్లో దీనికి సంబంధించి కిడ్నీకి సంబంధించి టెస్ట్లు ఎలా ఉంటాయి?
Not only in our hospital, all hospital. Firstly, if you come to a doctor for kidney problem, first the doctor will ask the history of the patient. The history, like if any comorbidities like diabetes, hypertension, thyroid problems are there, or if any family history of kidney disease is there, they will ask. Then the doctor will do some physical test, like to check what is your hemoglobin content, if any swelling is there in your hand or feet. After that, the doctor will prescribe some blood test. In blood test, we usually do renal function test or kidney function test, that is urea and creatinine. This test are to measure the waste products in our body. Then the doctor can also tell you to do some urine test. Urine tests are there to see whether protein is leaking in the urine, or blood is there in the urine, or any infection is there in the urine. After that, the doctor can tell you to do some ultrasound test, ultrasound of the kidney sizes, to see the kidney size, position, the quality, that is the echo texture of the kidney, and also to rule out any stones are there or not, the prostate is there or not, like that. Lastly, the doctor can tell you to do some kidney biopsy if needed. Kidney biopsy is a bedside test where a sample of kidney is taken by a long needle we pass through the skin. So, it is generally done in local anesthesia, and it is a daycare procedure, and it is a very important test in few cases of kidney disease. So, if the doctor prescribes you, better you can go for kidney biopsy also.
సో సమ్ పీపుల్ దే డోంట్ నో కిడ్నీ డిసీజెస్. సో వాళ్ళకి తెలియదు కొంతమందికి ఎప్పుడు ఏ స్టేజ్లో గుర్తించాలి. సో మనం ఏ స్టేజ్లో ఈ కిడ్నీ డిసీజెస్ అనేది గుర్తించవచ్చు? At which stage?
At which stage? Generally, first we know the staging of the disease. We do by blood testing. By the creatinine level, we do the staging, and there is a glomerular filtration rate (EGFR) testing we do. Based on that level, we do the staging. But one important thing to know, that GFR level depends on the age of the patient. So, a GFR, often the lab gives the GFR level, but GFR of 70 is different for a person of age 20 years and a person of age 70 years. So, we have to keep that in mind.
So, is this kidney diseases is complicated?
Complications of kidney diseases are many. As we told, that the most common complication is fluid accumulation, because main function of kidney is to filter the waste products. But if kidneys are not working, the fluid will be built up in the body, so there will be swelling in hand, legs, there will be cardiovascular heart complications, increased chest pain, increased chance of heart attacks, there will be brain complications like headache or depressed mood, irritability. Also in severe cases we can have seizures also, fits problem, and lastly pregnancy complication can occur, infertility issues will occur, and the most common complication in kidney disease are also anemia, because kidneys are important to maintain the hemoglobin and the bone health. So osteoporosis, osteomalacia, increased fractures, this can also occur in chronic kidney disease.
సో నెక్స్ట్ ఈ డిసీజెస్ ఎట్లా డయాగ్నోస్ చేయొచ్చు?
Diagnosis chronic I told that we have to do some blood test, urine test, scanning test, and then if required biopsy test. So based on that we generally diagnose which stage of the disease and then we go for treatment.
నెక్స్ట్ కిడ్నీకి ఇలా పాడవకుండా ఉండడానికి సో ఆఫ్టర్ ట్రీట్మెంట్ తర్వాత ఎలాంటి ఫుడ్?
The food is important. It's not after treatment. For diet is the first step of treatment. So if a patient is diagnosed with chronic kidney disease, we have to take care of 5 things or in diet. That is, first is protein, second is sodium, potassium, calcium and phosphorus. So what is protein? Protein is very important for our body. It is important for wound healing purpose, for enzymes, hormone purposes. So in chronic kidney disease what happens, we tell patients to restrict their protein intake because to decrease the amount of waste products in the body. But before taking a low protein diet, always consult your doctor, because proteins are also important in our body, and especially non-veg proteins are avoided. Veg proteins like dal, paneer, tofu can be taken. Coming to sodium, all kidney patient should take low sodium diet, ideally less than 2 to 3 gram per day, and food in high sodium like papad, pickle, this and outside food, fast food, they should be avoided. Coming to the third point, that is potassium. Kidney patients have a risk of having high potassium because the kidneys are not able to filter the potassium from our body. So food with high potassium like orange juice, melons, coconut water, banana, this should be avoided in advanced stages. Now
we will discuss after. శ్రీనివాస్ పల్నాడు జిల్లా నుంచి. శ్రీనివాస్ గారు నమస్తే అండి.
నమస్తే మేడం.
సో డాక్టర్ గారు ఉన్నారు, మీ ప్రాబ్లం ఏంటో డాక్టర్ గారితో చెప్పండి.
ఈ కిడ్నీ క్యాపింగ్ ఎంత ఉండాలని ఉంటుంది నార్మల్ గా అడుగుతాను మేడం.
ఒకసారి చెప్పండి, అర్థం కాలేదు. శ్రీనివాస్ గారు చెప్పండి.
క్యాపింగ్ ఉంటుంది మేడం.
సారీ అండి, మీ వాయిస్
హలో
చెప్పండి.
కిడ్నీ క్యాపిన్ గురించి అడుగుదామని వచ్చేది ఫోన్ చేశాను మేడం.
యా ఓకే మ్యామ్, ఈ విల్ టెల్ కిడ్నీ క్యాటిసమ్
creatinine.
యా
क्या cause or diet?
ప్రాబ్లం ఏంటండి? వాల్యూ
కిడ్నీ క్యాపిన్ 3.2 క్యాపిన్ ఉందన్నారు మేడం.
Creatinine.
Yeah.
Okay, creatinine is what I have heard is creatinine 2. So as I told uncle Babu, it depends on the age of the patient. So in lab generally 1.5 is the upper limit. So 2 is bit raised creatinine. We have to investigate and see why is the creatinine is raised, whether you have diabetes or hypertension, and diet restriction for creatinine 2 will depend on the diagnosis. If you are diabetic, then diabetic diet chart will be followed, and if creatinine is raised, salt should be decreased. Better to restrict non-veg items to some days, and we should visit a doctor for more detailed diagnosis and all.
సో శ్రీనివాస్ గారు డాక్టర్ చెప్పినట్టు మీరు ఈ ప్రోగ్రామ్ అయినాక డాక్టర్ని ఒకసారి కన్సల్ట్ అయ్యి డాక్టర్ చెప్పే వాటి కూడా కొంచెం పాటించండి, ఓకేనండి? సో ఐఎమ్ కంటిన్యూ.
Coming to diet, as I was telling, so sodium should be low, potassium should be low, and also calcium and phosphorus. In kidney patients we often see phosphorus level will increase. So food with high phosphorus like processed meat, packaged food or dairy products, they should be avoided. But before going to the diet, we should always consult your doctor, because for a detailed analysis that what is the staging of the kidney disease and how much diet should be restricted.
Next, coming to dialysis, what is the dialysis?
Yeah, what is dialysis? So before dialysis, as I am telling treatment, first we should follow a diet, and second there are medication tablets that we give. So normal tablets are to control the blood pressure of the patient, also to increase the fluid excretion of the patient, that is to decrease the fluid overload. They are normally called diuretics, and also medicines we give to improve the hemoglobin, improve the bone health, and to decrease the cholesterol. So these are the normal usual medications we give in kidney patients. If the creatinine is not controlled in these medications and the kidney injury progresses to advanced stage, then we call end stage renal disease, and in those patients they mostly need dialysis therapy. So as Deepika told, what is dialysis? In dialysis, it is a artificial process, it is a machine that filters our blood and remove the toxin and the waste products. There are three advantages of dialysis mainly. First, it will control the blood volume, that is the excess fluid will be excreted out, filtered out. Second, it will also maintain the electrolyte or the minerals of our body, and lastly it also maintains the blood pressure of our body.
సో ఇప్పుడు దీని వల్ల డయాలసిస్ వల్ల కలిగే అనర్థాలు ఏంటి, లైక్ సైడ్ ఎఫెక్ట్స్?
Side effects. So before coming to side effect, first we should know dialysis types and what we do in dialysis. There are generally two types of dialysis, hemodialysis and peritoneal dialysis options are there. In hemodialysis, what we do, generally we put a catheter, mostly it may be in the neck as a venous catheter, or a perma catheter can be placed, or a fistula in the hands can be done by a small surgery. So it is a access by which we can take the blood, it is filtered in a machine, and again it is taken given back to the patient. And in peritoneal dialysis, what happens in the patient, there is a their abdomen, there is a layer called peritoneum. So their body only acts as a filter. So a small catheter is placed in the abdomen here in this region, and the fluids are given in the abdomen. The fluid filter the body waste products and the fluids are taken out. So this can be done at home also. So both type of dialysis can be done in hospital center or at home, and we should you should discuss with your doctor that which type of dialysis is best for you. Coming to the side effects, that every patient has different response to the dialysis procedure. So it is difficult to tell all the side effects, but mostly it is a safe procedures and many patients undergo dialysis daily.
సో నెక్స్ట్ ఇప్పుడు మూత్రపిండ మార్పిడి అనేది ఎప్పుడు చేసుకోవాలి, అంటే ట్రాన్స్ప్లాంటేషన్ అనేది?
Transplantation is a new topic and a big topic. One thing we should remember, that dialysis process is only to support the kidneys of the patient. It cannot cure the kidney disease, because kidneys are filtering the waste products of the body. Same thing the machine is doing artificially outside. Transplantation is the only curative option of kidney disease, but all patients may not undergo transplantation. Detailed discussion with doctor is needed before undergoing transplantation. So what is transplantation? In transplantation, a healthy kidney of a healthy patient is transplanted or put inside the patient, and the patient having damaged kidneys generally do not undergo any removal of kidneys, that is no operation, but only the healthy kidney is placed in the body. And it is a series of tests are done before undergoing transplantation, and the patient has to take lifelong medications called steroids or immunosuppressant medication after undergoing transplantation, and they have normal quality of life after transplantation surgery without any problem.
సో ఎక్కువగా ఈ కిడ్నీ డిసీజెస్ అనేది ఏ ఏజ్ వరకు ఎవరికి వచ్చే అవకాశం ఎక్కువగా ఉంటుంది?
Age for transplantation or any kidney disease? Any. Kidney disease, one most important thing, can occur in any patients.
Yeah.
First, childhood also there is chances of kidney disease, as one of our caller told that they have genetic problem. If genetic problems are there, even pediatric patients of 2-3 years age also, kidney disease can also occur. Mostly we see in adults due to diabetes, high BP, but kidney disease and chronic kidney disease can occur from 1 year age to till 80 years age also.
సో ఇప్పుడు ఈ ట్రీట్మెంట్ అనేది తెలంగాణలో కూడా చేస్తారా?
Yes, in Telangana there is a very good treatment facility for both dialysis and transplantation. In dialysis in Telangana we have a hub and spoke model. That is, there are 3 government hospitals in Telangana which undergo dialysis centers, and they have many centers under those hospital which undergo perform the dialysis, and Arageshi and all other insurances are covered, and many hospital in Amor hospitals also dialysis is easily covered, and patients can come do dialysis and go. Usually in dialysis we do 4 hours dialysis session 3 days per week. So most hospitals in Hyderabad including Amor hospitals dialysis facility is there. And coming to transplant facility, there may be 2 types of transplants in Telangana. One is Jeevanarekha transplant program, that is cadaver transplant program, and second is the live transplant program. So both programs are running successfully in Telangana, and if any problem you can discuss with your doctor, with your nephrologist before going for dialysis option or transplantation option.
సో మ్యామ్ ఇప్పుడు ఈ కిడ్నీ వచ్చినప్పుడు ఏంటంటే చాలా మంది డిసీజెస్ వచ్చినప్పుడు ఫుడ్ అనేది ఎక్కువగా తీసుకోరు, దే విల్ నాట్ ఇంట్రెస్ట్ ఫుడ్. సో వై?
Main, as I told, in kidney diseases they have a problem in nausea, vomiting, so they will take less food and they have less appetite. But we have to see that the diet in chronic kidney disease patients and diet in patients undergoing dialysis are completely different. In chronic kidney disease patient, when creatinine is high, we can tell to restrict the protein and their diet is different. But patients undergoing dialysis, they need more protein, they need more calorie, so the diet chart of those patients are different. So any eggs or milk or dairy products, most common questions are whether they can take eggs or non-veg. They can take on eggs, non-veg, but better to avoid red meat. But all vegetables and dairy products, milk, curd can be taken, but every case has to be discussed with the doctor for their personalized diet.
సో మ్యామ్ అప్పుడు ఆఫ్టర్ ట్రీట్మెంట్ అయితే ట్రీట్మెంట్ తర్వాత కూడా ఎలాంటి ఫుడ్ తీసుకోవాలి, ఇంకా ఎలాంటి జాగ్రత్తలు, కేరింగ్ అండ్ ఫుడ్
after treatment? It's a long treatment. It's generally chronic kidney disease treatment is not for 1-2 months, because patients know kidney problem, there are long problem. So throughout the treatment or maybe till 1 or 2 years, you have to follow the diet chart. Once it is cured, your doctors will tell that you can eat everything, but chronic kidney disease treatment are generally usually lifelong treatment. So you have to follow, ask your doctor repeatedly that what food is allowed for you, what is not allowed.
Yeah, థ్యాంక్ యూ మ్యామ్. సో కిడ్నీకి సంబంధించి అలాగే క్రోనిక్ కిడ్నీ డిసీజ్కి సంబంధించి చాలా విషయాలు చాలా బాగా చెప్పారు. అలాగే మా వ్యూయర్స్ అడిగిన క్వశ్చన్స్ కూడా చాలా బాగా ఆన్సర్స్ చేశారు. థ్యాంక్ యూ మ్యామ్.
థ్యాంక్ యూ. నమస్కారం.
ఇది ఇవాల్టి జీవనరేఖ. నమస్తే.